Hi, all. Welcome to today's LTCCC webinar, Uninspected and Neglected. My name is Eric Goldwine. I am LTCCC's Policy and Communications Director, and this program is going to cover how new report reveals that high vacancy rates in state inspection agencies and how that hurts nursing home residents. So before we get into that, and we have two tremendous speakers up ahead after me, but I want to introduce you or remind you of who we are. LTCCC is a nonprofit, nonpartisan organization dedicated to improving care and quality of life for the elderly and adult disabled in long-term care. At LTCCC, we conduct policy research and analysis, systems advocacy, public education, such as these webinars, and we are home to two local long-term care ombudsman programs in New York. Today's webinar, again, it's called Uninspected and Neglected. Investigation reveals high vacancy rates at state inspection agencies. The slides and video will be available on our website at nursinghomes411.org/webinar-uninspected. And that link will be in the chat, and you'll get an email in a couple of days. Our two presenters are Peter Gartrell, a chief investigator for the Senate Special Committee on Aging. Peter has nearly 2 decades working to increase the public's understanding of government and business as a congressional investigator and journalist. And before his current position with Chairman Bob Casey, he spent 9 years conducting oversight on the Senate Finance Committee and Senate Energy Natural Resources Committee with Senator Ron Wyden. Then we will have Suzanne Messenger, the ombudsman, West Virginia long-term care state, who advocates for residents in a variety of matters related to residential long-term care, including resident rights, quality of care, payment, guardianship, conservatorship, powers of attorney, healthcare surrogate matters, and elder abuse and exploitation. And prior to that, Suzanne worked as legal aid of West Virginia for 8 years. Our agenda today is, I'm going to start by talking about some background on nursing home reform law and nursing home standards and state oversight requirements. And then I'm going to hand it off to Peter, who's going to talk about the new report and how understaffed inspection agencies put residents at risk. And then we'll hear from Suzanne Messenger about the ombudsman perspective and offer some tips to ombudsmen and advocates on how to help residents in this very challenging environment. And we will close with Q&A. So if you've attended LTCCC webinars before, you might be familiar with the nursing home reform law. This is a law passed in 1987, and it requires every nursing home that participates in Medicaid and Medicare to agree to meet or exceed the standards laid out in the reform law and its implementing regulations. And again, participation in Medicare and Medicaid is voluntary, and nursing homes that don't wish to meet these standards are free to run private facilities. But those that do are required to follow the federal law that every nursing home is provided the care and quality of life services sufficient to maintain their highest practicable physical, emotional, and psychosocial well-being. And the law emphasizes individualized, patient-centered care, and it lays out specific resident rights from good care and monitoring to quality of life, maximizing choice, dignity, and autonomy. So if these laws are so strong, why aren't nursing homes decent and safe places to live and work? And this is at the heart of today's program and the part of the report that we'll be discussing. And the answer is that the laws and standards can only make a difference if they are enforced. So the problem is that federal data, our studies, countless government reports, your eyes, your ears, if you're an ombudsman, or if you're a resident, or if you're a family member, they all share a similar story that these basic baseline tenets are largely unrealized, and that oversight in nursing homes is lacking across the country. Our research, we've been examining this issue for decades, but a couple years ago, we published a report called Broken Promises, which assessed nursing home oversight from a 3-year period, and found that while there's harm everywhere, it's rarely reflected in deficiencies and in citations. We found that surveyors record 1 citation for every 13 residents. This is in the 3-year period from 2018 to 2020. And that number by itself might not be that alarming, but of those citations, only 5%, 1 in 20 of those citations were categorized as G or above, or what we call harm citations. So then only 2% are categorized as immediate jeopardy. So in other words, while there's a citation for every 13 residents, there's only a harm citation for roughly 1 of every 260 residents. Those in the audience here, I'm sure I'm not sure, but I suspect that your experiences going into nursing homes or with family members, that you see harm that happens more frequently than 1 in every 260 residents. We find that infection prevention and control citations account for 8% of these deficiencies, while other categories such as antipsychotics, pressure ulcers, resident rights, staffing, and quality of life are less frequently cited. This varies by region. Some states are more likely to cite than other states. New York and New Jersey are consistently in the bottom quintile of most citation metrics. And it's important to note, this does not mean that there's less harm that's going on in these states. It does not mean that there's less violations of federal law going on in these states. It merely means that that when there is violations of standards, that they are not necessarily being cited. This report's available at nursinghomes411.org/survey and enforcement. And we also published a guide covering important guidance on several categories, including program background and responsibilities, survey process, state oversight, enforcement, civil money penalties, information disclosure, and more. Just as an example from this report, we published the guidance on survey team size and composition, and how frequently nursing homes should be surveyed, what to do when there's a conflict of interest. And this is just one page. That report, again, is on our website at nursinghomes411.org. This is the scope and severity grid. So I mentioned previously that harm citations are rare. And what that means is that the citations G or above, GHI, JKL, are less frequently cited. The deficiencies G or above are less frequently cited than those that are D, E, F, and B, C. Again, 95% of citations are at the D through A, or no harm. Then before I pass this off to Peter, this is just an example of what a deficiency looks like. Again, each of the deficiency statements will include an F tag. That is, what is being cited? Is it antipsychotics? Is it staffing? Is it infection control? Then the scope and severity. So that is what letter. Is it harm? Is it no harm? Is it immediate jeopardy? Then it'll provide the evidence to support the deficiency. And before I hand it off to Peter, who will talk about the report, what we're concerned about is that when nursing homes are not being, when the standards are not being followed, we're concerned that the oversight agencies are not responding accordingly. And there is data and anecdotes to back up this concern. And on that note, I'm going to stop sharing and hand it off to Peter.
Thank you. Thank you, Eric. Good afternoon, everyone. It's great to be with you today. My name is Peter Gartrell, and I lead investigations for Senator Casey on the U.S. Senate Special Committee on Aging here in Washington, D.C. Before getting started, a thank you to Eric, thank you to Haley, Richard, and all the other folks at the Long-Term Care Community Coalition for hosting this webinar and giving me the opportunity to discuss Senator Casey's oversight work. Your organization's work and advocacy are vital. It gives voice to people who do not have the ability to speak for themselves. So thank you for all your efforts. Last year, Senator Casey directed his staff, that's me and a couple other folks on the committee, to begin investigating the capacity of state inspection agencies to enforce health and safety standards in the nation's 15,000 federally certified nursing homes. This work and this interest came out partly from a long line of GAO and OIG reports that had looked at the capacity of what are known as survey agencies to carry out their jobs. And one thing that came up over and over again was the problems with staffing. And we really wanted to take a deeper dive. So what we did was Senator Casey sent a letter to all the states. We got responses from all the states back. So we were really able to get a good snapshot in time of the issues. Over the course of the months, we did the investigations, we wrote the report, and in May, Senator Casey held a hearing before the Aging Committee on the issue, releasing the findings of the investigation in a report called Uninspected and Neglected. And I appreciate LTCCC using that name for its webinar. It's based on 2,000 pages of documents provided by every state in the nation, as I said. As Senator Casey said in the hearing, the report paints a picture of a system in crisis. Underfunded and understaffed state agencies have fallen behind on basic duties like conducting annual nursing home inspections and responding to resident complaints in a timely manner. Witnesses at the hearing confirmed that this lack of investment put nursing home residents at risk. During the hearing, Senator Casey cited the example of an 84-year-old woman whose leg was broken at a nursing home in central Pennsylvania. According to press reports, the leg broke with an audible snap, but a week passed before she was taken to a hospital where she died. The county coroner cited negligence as a contributing factor to this woman's untimely death that occurred one day before her 85th birthday. Just really awful story, but it's not the only one. In another instance, the investigation cited a Georgia nursing home where a staff member punched a resident in the mouth. Think about that for a second, requiring hospitalization and prompting a police visit and report. It really doesn't take a close reading of the regulations to see the problem in this Georgia nursing home. But despite intervention from the ombudsman, months went by before the survey agency responded. And Georgia is one of the states that had reported severe shortages in its survey agency, which one state after another said contributed to these issues. If there is a silver lining to be found in these two cases that I just mentioned, and it's hard to find, it's that at least there is a record of the issues that occurred. Senator Casey's concern, which he expressed at the hearing, is that countless more horror stories never see the light of day due to inadequate oversight. Federal data showed that as of mid-May, 1 out of every 9 nursing homes in the nation has not received a comprehensive annual inspection in 2 years. 2 years. Infrequent annual inspections have led to more residents and families to filing complaints, which states are failing to investigate quickly. And time is of the essence when state inspectors need evidence to prove serious deficiencies like physical abuse, sexual assault, or inadequate medical care have occurred. It's just like a police or criminal investigation. The trail of evidence goes cold, and the fear is that this trail is going cold for too many residents and families before nursing home inspectors can arrive on the scene. The investigation, which I've got right here, and you can also find on the Aging Committee's website, found that 32 state survey agencies have vacancy rates of 20% or more among nursing home inspectors, and 9 of those agencies have vacancy rates of 50% or higher. Just think, I don't know whether any of you might be football fans, but just think that if you put a football team on the field with a defense that only had 20% of the players that was needed. So instead of having 11, you had 8 or 9. Or if you were at a 50% rate, you only had 5 or 6. And imagine how they'd end up doing against the offense. It wouldn't be a pretty picture. And I think that's what you're basically seeing right now in survey agencies across the country. States directly linked staffing shortages to inspection delays and said flatlined federal funding over the last decade is making these problems worse. Simply put, federal dollars are not keeping up with growing workloads and the need for states to offer competitive salaries to attract workers. Today, the federal government is spending tens of billions of dollars on nursing home care, but Congress appropriates less than 80 cents per resident per day on nursing home oversight. Not even enough to buy a cup of coffee. There are 1.1 million nursing home residents in the United States, and it's imperative that as the nation ages, we do better by older adults and people with disabilities who call these facilities home. Unfortunately, this call to action is not new. 37 years ago, 37 years before Senator Casey released his investigation, the Aging Committee held a hearing to examine the state of nursing home oversight. That hearing was chaired by another Pennsylvanian who preceded Senator Casey as chair, Senator John Hines. In that 1986 hearing, Senator Hines and the committee heard about the critical need to adequately fund nursing home inspection agencies and how not doing so would have, quote, grave consequences, end quote, for care quality. That hearing, which came on the heels of the landmark Institute of Medicine report, was a key step on the way to congressional passage of the groundbreaking nursing home reforms signed into law by President Reagan the next year, which Eric referred to in his presentation, 1987 OBRA. The findings of Senator Casey's investigation must not be ignored. Here are 4 steps he outlined during the hearing that we must work on going forward. First is funding. Congress must prioritize the nation's 1.1 million nursing home residents by investing in oversight, as the Obama, Trump, and Biden administrations called for. There are not many things that all 3 of those administrations agreed on, but increasing nursing home oversight funding was one of them. Second is transparency. The investigation makes clear CMS needs to track and report survey agency staffing, given that staffing is a leading indicator of states' performance conducting nursing home oversight. Third is protecting taxpayers. States, CMS, and independent watchdogs need to closely examine the use of contract inspectors, which I didn't get into a lot here, but essentially states are using contract inspectors to fill gaps when they're unable to hire permanent inspectors because of low salaries, and make sure proper guardrails are in place. Finally, workforce. The investigation shows that expanding the healthcare workforce will help healthcare providers, deliver better care and ensure states deliver better oversight. And that's because survey agencies rely heavily on nurses to conduct this oversight, which is a requirement in some instances by CMS for certain types of health-related investigation. Often it seems this type of work is categorized as being an issue that only older adults should care about. But I'm here to tell you today that as a 40-year-old man in the early stages of caregiving for his own parents, these policy decisions affect not only the lives of my parents and older relatives, but our generations, my generation's ability to participate in the workforce. As a nation, we must demand that the aging services system is not held together just by duct tape and string and relies only on underpaid guardian angels. We must demand investment. Senator Casey and his staff are beginning the work of moving the report's recommendations forward, seeking to find common ground to make sure nursing home residents are kept safe and receive the care they deserve. I'd like to thank the LTCCC, I think I got the right number of C's in there, again, for having me here today. I look forward to hearing Suzanne's perspective from West Virginia and look forward to answering any questions from folks on the call today. Thank you again.
All right. Thanks, Peter. And Haley, if you want to get the slides up for Suzanne, and you did nail the number of C's, Peter. So it's 3 C's. You got it.
Thanks, Haley. Well, like Peter, I want to thank the Long-Term Care Community Coalition for all the hard work that they do. I know they're New York based, but West Virginia gets the benefit of a lot of the materials and educational events. And I am a frequent participant on the other side of the screen for these webinars. So I'm really happy to have the opportunity and hope that I can give back in some small way. So one of the things when I participate in these webinars that have the target as more than one state, you quickly realize that if you know about what's happening in one state, you know what's happening in one state. So I thought I would share with folks a little bit about West Virginia and what is happening here. We are a pretty small state with only just about 1.75 million total people population wise. Our largest city is our capital city, which is in Charleston, just under 47,000. And the picture that you're looking at is actually Milan Puskar Stadium at West Virginia University. And that stadium has a capacity of 60,000. So in the fall, when the stadium is sold out, actually Mountaineer Field is our largest city for several weekends in the fall. Most of our cities are much smaller. We are quite a rural state with not the best highway system. So to get from one nursing home to another requires a lot of travel and sometimes travel on not very good roads. I'm the State Long-Term Care Ombudsman in West Virginia, and I work for the Bureau of Senior Services. Our program is what is referred to as a decentralized program in that I'm the only state employee, and then the state contracts out with one nonprofit agency here in West Virginia, Legal Aid of West Virginia, who operates our local long-term care ombudsman program. And when they are fully staffed, they have 11 paid ombudsmen. Right now, 2 of those positions are currently vacant. So we're struggling with staffing just like everyone else is in this environment. We have 125 nursing homes and 10,563 nursing home beds. Of those 125 nursing homes, 15 of them are 5-star facilities on Care Compare ratings, but 34 are 1-star facilities. So we are struggling with our quality of care, at least by Medicare's ratings. And I know we could debate all day whether that's an accurate reflection of what you actually see in the field, but it is a tool that many of our residents and family members use to judge the care that they're about to receive in a facility they're considering for administration. Our survey agency has, when fully staffed, has 16 nursing home surveyor positions, which includes 3 managers. Right now, 7 of those positions are vacant. So that's about 44%. So we are one of the 32 states in the country that Peter referred to with a rather high vacancy. We're not quite at 50%, but we're working on it. We do not use contract surveyors, although we have in the past. And it isn't for any necessarily, it's not for lack of trying. The state did submit bids to several contract agencies to try to obtain contract surveyors, and those bids were rejected. So we don't have any contract surveyors. We have 6 nursing homes right now, that's about 5%, who have annual inspections that are greater than 15 months. And I know you're thinking, well, annual inspections, that should be every year. Well, CMS gives the survey agency a window in which to conduct an annual inspection. And that window is anywhere, not supposed to do it any sooner than 9 months after the last one, but not any longer than 15 months after that last one. And that's to kind of reduce the predictability, because if it was always exactly 1 year, nursing homes would know every time the surveyors were coming for an annual inspection. And we want to try to reduce that as much as we can. So here in West Virginia, we've got 6 that are outside that window, and the furthest one out is 15.92 months, which is not awful. But there's 122 complaints in the pipeline waiting to be investigated. And the oldest is from last year, July. So the oldest is more than a year old. There's a couple of reasons why that's a problem. One, it is possible to get caught up on your annual inspections rather easily. If you think of inspections, and whether we're talking about annual inspections or complaint inspections, as kind of buckets that the survey agency has to fill in order to comply with CMS's requirements. The annual inspection bucket is stationary. In West Virginia, there's only 125 nursing homes. And once they get 125 done every year, then they start over. There's not any additional ones added. We actually have a moratorium on nursing home beds. So we know that for a fact. But that's not true with complaints. No matter how many additional complaints they investigate this month or next month, the bucket is continuously being filled. There's no pause on complaints, no stoppage. So it's unrealistic to think if they're already a year behind with the current circumstances, there's no way to get caught up. Our survey positions are all state positions. There is no distinction in this. When you're a nursing home surveyor, you're a nursing home surveyor. No matter whether you're a nurse or a doctor or a former nursing home administrator or a social worker or a dietitian, the salary is the same. The job is not a great job. As I said, it's a lot of travel on good roads or bad roads, excuse me, and a lot of time away from families. So it makes it really difficult for young people who have young families to be able to do the job well and to maintain their families. Next. I forgot I was the one changing the slides. Sorry about that. So what can we do about all of this? And I've just got 4 tips, and none of them are rocket science. I'll give you a heads up, but sometimes it helps to think about them in a thoughtful, focused way. So the first thing that we can do as ombudsmen and residents and family members is to make sure that we're informed. And really what I'm talking about here is look at your state. How does your state process work? Every state is different. The way that you get information from your state may be different. Here in West Virginia, one of the benefits of being a small state is it's really like one big small town. So our approach is much more collaborative than perhaps what works in your state. When I wanted some of these numbers, I just picked up the phone and asked. I didn't have to fill out 27 papers or wait 6 weeks or anything like that. And they do the same with us when they need data. So find out how your state process works. Find out what's working good in your state. As I mentioned earlier, on a relative scale, our state is doing a pretty good job keeping current with their annual surveys. I know there are many states that would love to only be 5 behind and only to have their longest one 16 months. So we're doing a pretty good job there. We're not doing such a good job with complaint investigations. And what that means for residents is our state has a triage process of how they process complaints, and I believe every state does. So that's another key area to learn about. How does your state agency prioritize their complaints? Which ones get investigated first? That's really important. And typically they use some key phrases. If they think there's the risk or if there was actual harm that occurred, those are at the top of the list. And then those no harm complaints that the Long-Term Care Community Coalition does such a good job of illustrating in their quarterly reports are often deprioritized. But as the LTC points out quite regularly, many of those allegations that are considered no harm actually really impact our residents in a very negative way and interfere with their quality of life and their quality of care. So it's important to know how your state triages those complaints, and are there things that you can do when you're making a complaint or helping a family member make a complaint or a resident? Are there ways to state your complaint that might move it up in the triage process if your state is one of the states that's behind on their complaint investigation? The National Ombudsman Program Coordinator, who works for the Administration on Community Living, recently sent us a tip in one of the meetings that she was sitting in with one of the CMS regions. They pointed out that when the ombudsman have made a number of similar complaints, when we make another complaint that's related to that, we should point out in our complaint that we have made that complaint 3 or 4 times, or that this issue is similar to the complaint that we made in June and March and January. And the reason for that is the survey agency then can track that as a pattern or a trend. And if it's a pattern or a trend, it might move it up in their triage process. So that was something I just learned this week and wasn't aware of that. Next, be persistent. There's a real temptation knowing that complaints are so far behind. What's the point in registering those complaints? Well, we don't want to stop making those complaints. That might indicate to the regulators and to CMS that things are actually getting better, when the reality is they're not. We would just be frustrated by not making those complaints. So continue to register those complaints. Make sure that you're following up. Here in West Virginia, we have a tickle every 30 days to touch base with our survey agency to see, just to make sure that the system is still working and our complaint is still in the system. Unfortunately, our survey agency has a pretty strict confidentiality, even about complaints that we register. So they can't share a lot of information with us or about when our complaints might be coming up for investigation. So we don't get a lot of information, but we can be a burr under their saddle and remind them we're not going away. We know this complaint is still out there, and we're going to check on it at least once a month. As ombudsman, make sure you document those records. Make sure that you document your contacts with your survey agency and what kind of a response you get. Those responses can be collated by your state ombudsman, by your program directors, and shared with others when the Senate Committee on Aging does their next investigation or wants to follow up. That's the kind of information that's really helpful and really useful to the policymakers about what we're doing and what we're seeing and what kind of responses we get to our efforts. So be persistent, continue to make those complaints. However, we also have to be realistic. And I realize what I'm about to say might be provoke a little bit of controversy, but that's okay. That'll keep people from nodding off after lunch. We have to realize that making these complaints to our survey agency, very realistically, they're not going to get investigated for a year. And as ombudsman, our goal is to resolve concerns, the residents' concerns, to their satisfaction in a timely way. So what can we do in addition to making those complaints? I'm not suggesting we do this instead of this. These are things that we can do in addition to making complaints to our survey agency. And these apply to ombudsmen and friends and family and residents. As ombudsman, we need to stay involved and we need to do what's within our lane to address these complaints. We're not the enforcers. We can't cite and we can't fine, but we can do a lot of good work on behalf of our residents in making things better. And we need to make sure that we're doing those things that we're able to and that we're responsible for as long-term care ombudsmen with the permission of our residents. And then we need to look at other agencies that might also be able to make a difference and maybe aren't struggling in the same way our survey agencies are. And that might be agencies like our quality improvement organizations or Medicaid fraud. It's also worth keeping in your tool belt that if your survey agency is struggling, maybe it makes sense to go up the chain with the Centers for Medicare and Medicaid Services and look to the regional offices. All of these things need to be done if you're an ombudsman in conjunction with your state ombudsman. I'm not suggesting you go renegade here. We want to contact your state ombudsman because he or she knows best about what's working in your state and what might be a realistic approach. And then when we contact these other agencies, it's important to document in your case management system those contacts and what the results were. And then finally, be and stay involved. It's really important for our residents, for us to stay on top of these issues. Again, work with your state ombudsman, with your program directors to make sure that you're acting consistently with their plans for the direction of your state's ombudsman program and how that they see addressing this issue. And that might be participating in opportunities for public comment where you can. Certainly don't let that pass you by. And however your state works, in our state, our local program prepares their comments and submits them to me. And then I sort of collate them and then I submit them on behalf of the program. That's how it works in West Virginia. You want to participate in state and local task force. Sometimes counties or cities recognize this as an issue, and where we can magnify our residents' voices, that's always a good opportunity to make sure that this issue is being raised and it gets the attention that it deserves. Be sure and provide information to your residents and families and educate them about the complaint process, not only how to make a complaint, but what they can expect. A lot of times residents and families are very frustrated if they've made a complaint and they haven't heard back. We need to let them know what they can expect as a result of making this complaint. And unfortunately, it's not immediate results in most states. So what can we do? What are the other interventions and approaches we can do to help make things better for their resident while we're waiting for the complaint process to work? Don't underestimate your resident councils, your family councils, your citizen advocacy groups, if you have those. We've had resident councils here in West Virginia that have been very creative in trying to solve some of the problems that they have had with their nursing home care. One of them actually wrote the head of the corporation and asked them to come to their meeting and talk to them. And lo and behold, they actually did. And it seems like a good conversation. The residents were very pleased with the response, and they set up a follow-up meeting to see how things were going. So don't underestimate the power of your residents. Use them in this solution. And then finally, in collaboration with your state ombudsman and at their direction, there may be times when it's time to get the media involved. Shine a spotlight on what's going on or what's not happening, because the goal in all this is not necessarily to bring attention to the ombudsman program or promote the ombudsman program. It's really to highlight what is not happening in nursing homes as a result of the formal process that's set up to address our concerns, and why the reason is for that. And many times it's because states and the federal government have not invested in the enforcement process, and they've set up our survey agencies to fail. And that means our residents fail, and we can't have that. If you have any questions, if I can ever be of help, that's my contact information. Please don't hesitate to reach out and call me. Thanks.
Thank you, Suzanne. It's great that we have some action steps here in addition to the knowledge that we've hopefully gained from Peter's presentation and yours. I'm gonna, before moving to Q&A, I want to just share a few of LTCCC's resources. Then we have a lot of questions in the Q&A, so hopefully we can get to those. So I'm sharing screen, slideshow from current slide. So just for the next few minutes, I'm going to talk about a few LTCCC resources. This is our website, nursingHome411.org. We provide material that is helpful for families, for ombudsmen, for legislators. We also post a whole lot of data that can help you look at a given nursing home or a group of nursing homes or an area. So again, that's all available on nursingHome411.org. Of note, I wanted to share our family empowerment and our Family Council Resource Center. Suzanne just mentioned the power of resident councils and the power of family advocacy, and we're really working to we're looking to work with families of nursing home residents and give them the tools and the resources so that they can better advocate for their loved ones. So this page, nursingHome411.org/families, includes fact sheets, includes a toolkit, and we offer a free Zoom meeting room for family councils. And if you want to get in touch, you can email families@ltccc.org. And this is our learning center. It includes it includes materials for residents, for families, and for ombudsman, including links to webinars, including today's, which we will have up hopefully in the next day or so, our fact sheets, resources for families and ombudsman, dementia care and advocacy, podcasts, abuse and neglect, you name it, it's all here. So again, that's nursinghomefour11.org/learn. And then we have fact sheets on a number of topics, including abuse and neglect, resident rights to dignity and respect, informed consent, and these are all available at nursinghomefour11.org. And I'm just going to skip ahead in the interest of time. This is our state page. We have each state available, including their staffing data, links to their ombudsman program, nursing home ratings, and more. Then finally, before I set up for Q&A, we hope that, especially if you're a family member, we hope you can join us next Thursday to talk about family councils and we're going to hear from family council members and what they have to say. Again, that's Thursday, July 27th. It's a Zoom meeting, but we broadcast it on Facebook Live. This program will be posted, video and slides from this program will be posted on nursinghomefour11.org/webinar-uninspected. And we hope you can like our Facebook page and see us next Thursday for our family empowerment program. And there is no August webinar, so hopefully you can relax a little bit month from now, but we'll be back in September. And I'm gonna well, lastly, and I promise this is my lastly before the Q&A, you will get an email on Thursday if you attended the program, and that should serve as confirmation that you attended, and that'll come Thursday, and that will also include a link to the video and slides from the program. So I'm going to get to some of the Q&A. I'm trying to multitask here. So I'll start with Beverly's, and I think I can actually answer this one. Do you think the no harm could be underreported? Yes, we think that there's some kind of double negatives in here, but we're of the belief that there is more harm citations than is being recognized by surveyors, and that's for reasons that I think were discussed here. There's a lack of oversight, there's a lack of frequency of surveys, and a lot of these agencies are shorthanded. I liked Peter's metaphor that if it were a football team, they only have 8 of 11 players. So if you only have half or 3/4 of a team, you're going to miss some things. So next question. This is from Marla. What is the solution to surveyors who don't cite for violations? Is it more training? And then from Marla's experience, even when a complaint is investigated, it ends up being unsubstantiated, even when there is evidence provided indicating that there could be a violation. Suzanne or Peter, do you want to take this one?
I'll try to jump in, Eric. First of all, I don't have the solution, but I do think in many cases training would help, particularly in states where there's been a lot of turnover with the surveyors. It can be a huge learning curve for new surveyors to get up to speed. So I do think more training programs that could improve the retention of the surveyors. The longer the surveyor is in the business, the more likely they are to be experts at using the guidance to surveyors in interpreting the regulations in a way that maximizes the benefit to the residents. And then in some cases, it's just, it may be a bureaucratic or a political issue where the survey agency is more attuned with the industry than they should be. And that's something we have to watch for and be aware of. And we can work to raise that issue to make sure it comes to light and gets addressed.
I think Suzanne's right. I mean, I think in any industry, any job, there are going to be things that are missed. I think the question is, are you missing it 1 out of 10 times, or 1 out of 100 times? Are you missing it 9 out of 10 times? And if you're missing things repeatedly, then I think that there's a question about either the individual, as there would be in any job, or as Suzanne mentioned, is there more of a systemic problem? And I think the thing to keep in mind is that there's been concern from independent watchdogs and consumer advocates for decades, really, about variation of regulation enforcement from state to state, but there's also variation from region to region within a state. And I mean, at the end of the day, these are hugely difficult jobs. I mean, the amount of information that surveyors have to retain to do their work. I mean, they've got a handbook that's the better part of 1,000 pages, and it's just, and it's long days, long hours, and generally not being paid well. And at any point, you can walk across the street and make more money at a hospital, or doing compliance in a nursing home, or anything else if you're a nurse or one of these other allied health. So I think you've got a real retention problem, and I think the training can help. And just like any other industry, you're going to end up with some bad apples, whether it's meaning to be bad apples or just not kind of thinking through the job. But my experience with talking to most surveyors is that they're really dedicated to doing their work and doing things that, putting in hours and time that, and really caring about residents in a way that I have a hard time believing that they're doing anything other than trying to do their best.
Thanks. This next question, I really like this next question, and this is from Melinda. Is there an effort underway to review and transfer leading practices from states whose percent of vacant surveyor positions decreased from 2002 to 2022? And how have they attracted and maintained surveyors? And I guess my add-on question to this is, what can we learn from those states?
Yeah, I mean, so I think that this is a discussion that this report was trying to prompt. Partly, I think that there is some consideration of this within CMS, but really, I think where a lot of the solutions are going to come on this is from states talking to each other. There unfortunately are very few examples of states where the vacancy rate has declined, but there are states from 2002, and there was basically a GAO report in 2002 that looked at vacancy rates, and the vacancy rates that we found in 2022, the majority, I think it was 30 something states, have higher vacancy rates than they did 20 years ago, which we're going in the wrong direction. But some states, just for example, have decided to go from only hiring nurses to being more flexible in their hiring, which we think is a good idea and is one of the recommendations that we have. Some states have experimented with different types of recruiting and different types of incentives, worked with their state legislatures to increase salaries, which 42 of the states cited salaries as one of the issues with recruitment and retention. So I think that there's a lot of information sharing, and there's also, and that's being done on a ad hoc basis, state to state, and through the CMS regions, but also through an organization called the American Health Facility Survey Association, just proving that there's an association for everything, which is the where surveyors meet on a annual and semi-annual basis. And to, in a conference like anybody else would go to. So a lot of information sharing there.
Thanks. And this is from an anonymous attendee. What can a resident or family do when surveyors don't show to investigate a complaint, even when an ombudsman is involved? I think this is a Suzanne question.
Yeah, I'm going to give that to Suzanne.
Well, certainly talk with the ombudsman about steps that can be taken. Residents or families can also contact the survey agency. There's an organizational hierarchy in all of those survey agencies, and make a complaint. Let them know that this is not acceptable. And you may have to work your way up to the chain. We get a number of complaints that came from the governor's office, or sometimes even our U.S. Senator's office that folks complain. So don't hesitate to work the system in your state. If it feels wrong, make a complaint and keep asking till you get the answer you're looking for.
I think Suzanne's absolutely right. And I think one of the things pulling from her presentation is document at every step of the way so that there's a paper trail. And in criminal prosecutions, there's a lot of talk about building from the bottom and going towards the top, and starting at the bottom and showing that you've worked your way through the process all the way up, I think is really important in these cases, because I think that as you go higher up, you get more credibility if you say, like, look, here's this problem. I've gone to every step along the way that I was supposed to do, haven't gotten responses. Like, will you be the person that helps me? Suzanne, would you agree with that?
100%, Peter.
Great. And our last question, it's 2:00, but this is from Nina Lowenstein. Hi, Nina. Peter, what should CMS be doing to ensure appropriate state survey enforcement?
Well, I mean, I think I want to give some credit where credit is due. The Biden administration in 2022 put out the most comprehensive nursing home reform agenda that has been put out by a White House in decades. I mean, it's not even close. And Richard, who's on the call, who doesn't give many administrations credit for anything, I think even he would acknowledge that the goals that the Biden administration put out were right on. Look, CMS has issues. I think that they are trying to move the ship in the right direction. I think that the president is trying to move the ship in the right direction, but they're being hamstrung by the same funding issues on the survey and certification side that states are. I mean, it's coming from the same pot. And basically, over the last 9 years, funding for survey and certification, dedicated funding that Congress is appropriating, has increased 2.5%. And it doesn't take close reading of the news to see that inflation and healthcare inflation over that time period, even before the recent run-up, has far outpaced that. And so that's affecting CMS's ability to hire, and our report goes into that as well. So, I mean, I think some of it is incumbent. I mean, I think, yes, there are questions to ask CMS about what its enforcement, but I think the bigger question is Congress and the willingness of appropriations committees on the House and Senate side to put money towards this issue. And my boss has been working on this and putting in those appropriation requests for years. And that's part of the reason why we jumped off on this report, is because this is an issue that has been going on for too long, and we can't keep kicking the can down the road. So is there more work for CMS to do? Yes. I mean, look to our recommendations, look to IG recommendations, look to GAO recommendations, particularly the ones that have not been implemented. But a lot of this really falls on Congress. And I think that there's a role for everyone on this call to reach out to your senator, reach out to your representative and say that this is an issue that needs to be addressed and taken seriously, point them to their towards our report and our office. And, we are happy to talk to anyone and everyone about it. I hope that answers the question, Eric.
Yes, thank you so much for Peter, and thank you, Suzanne, for joining us today. And thanks to all those who attended. This has been one of our most attended or our largest attendance programs, and we're grateful for that. Again, we will have video and slides on our website at nursinghomeforward11.org/webinar-uninspected. Video will be posted later this week. And a reminder, there's no webinar in August, but we will be back in September. And if you're not on our email list, go to nursinghomeforward11.org/join, and you'll be the first to find out what the subject of that webinar is. Thanks all, and enjoy the rest of your Tuesdays.
Thanks, everyone. Have a great afternoon.
Thank you.